Welcome to Pharmacy Prep. Insulin, a complete review. Insulin action timelines. So, the types of insulins are divided based on their action timelines, like onset of effects, which means the initial time it takes for the insulin to start working, peak, the period when the insulin effects are at their strongest, and the duration, the total time the insulin effects last. So, the insulin molecule is modified to alter its absorption and distribution, and that enables have a different duration of insulin effect in the body. Based on this, insulins are divided into two major types: bolus insulin, basal insulin. Bolus insulin further divided into rapid acting and short acting insulins. And basal insulins are divided in intermediate acting, long acting, ultra long acting, and then premix insulins. Well, here are the examples of types of insulin currently available and approved by the FDA. The rapid acting insulins are insulin lispro, insulin aspart, insulin glulysin. Short acting insulin is regular insulin, and intermediate acting insulins are insulin NPH. Long acting insulin are insulin glargine, insulin detamir. Ultra long acting is insulin degludec, and there are premixed insulins with rapid insulin with NPH and also regular insulin with NPH combinations. To understand these types of what enable those insulin structures to have different absorptions and different duration of effect and peak effect, it is important to understand the insulin structure. Insulin structure consists of two chains, chain A with 21 amino acid and the chain B 30 amino acids. And these two chains are bridged by or linked by disulfide bond bridge, and there is a two disulfide bond bridges and also the internal disulfide bond bridge. And also the active form is the monomer. However, at room temperatures or at temperatures, this monomer turns to the hexamer form of the insulin. Well, here what makes the key differences in their insulin preparation that make them difference in their insulin mechanisms. First, let's start with insulin peak effect of regular or rapid insulin. Rapid insulins or monomer forms are prepared into monomer form, and they're formulated to prevent formation of hexamer form of the insulin, and that helps rapid action rapid acting insulin to have a rapid absorption. And then regular insulin in, exists in the form of the hexamer solution, so that enables slow absorption and then also slightly longer duration of effect. Then next, NPH insulin, which is a hexamer of insulin but mixed with zinc and protamine, and that combination complex of zinc, protamine, and hexamer of insulin complex gradually dissociates and that prolong the duration of effect of NPH or intermediate acting insulin. The next one is the long acting insulin, like detamere. Long acting insulin detamere is attached to the fatty acid chains, and those fatty acid chains bind to the albumin, serum albumin, and then gradually dissociates, and that enables to have a longer duration of effect of detamere insulin. And then glargine, long-acting glargine insulin modified to its pH, and in those pH 4, which is different than the blood pH, and underneath these subcutaneous tissues, this makes the microprecipitate, and those microprecipitate gradually release into the blood circulation, and that extend the duration of effect of the insulin. The next insulin is a ultra long acting insulin, which is a degludec. Ultra long acting insulin is prepared as a multi-hexamer form of the insulin, and which deposits into the subcutaneous tissue and gradually dissociates and release into the blood circulation, and which thus enables to extend the duration of effect of the insulin. So these are the types of insulins. And here are those generic and brand names of insulins. Rapid acting insulin brand is Humalog, insulin Lispro, insulin Aspart, Novorapid, insulin Glulysin, Apidra, and short acting insulins or regular insulin, which comes with the brand Himalin or Novolin R. And then intermediate acting insulin is insulin NPH, which comes as a Himalin N and Novolin N. Just to not to be confused, there could be sound alike names, or here Himalin R is for regular, whereas Himalin N for NPH. Same thing with the Novolin and Novolin R for regular, Novolin N for NPH. This is often considered as a look alike or sound alike drug, LASA drug, which often results into errors in insulin sound like names. And then the long acting insulins are insulin glargine comes in brand Lantus and also Toujeo, and then the biosimilar, which is a Basaglar. And insulin detamere brand is Levemir, and ultra long acting insulin, that is degludec, brand is Tresiba. So let's see what makes them rapid acting insulin. Rapid acting insulins are modified to prevent them forming from hexamers. From they are modified into monomer, so they are formulated to prevent hexamers. And then the rapid acting insulin onset effect is about 10 to 30 minutes, and then peak effect can be 30 minutes, and the duration can be 3 to 5 hours. So therefore, this is primarily used for postprandial blood glucose levels. So this should be associated with the meals, like generally taken with the breakfast, lunch, and dinner. So because it has to be taken with the meals, it works on the meals produce glucose, and that means that is called postprandial blood glucose levels. So it works fastest. This is the fastest of all insulins. The next one is a short acting insulin, also known as regular insulin, which is a hexamer form of the protein, and which delays the absorption, and that enables to have extend the duration of effect. And this one has the onset about slightly slow onset than the rapid acting insulin, which can be 1 to 1.5 hours, and peak can be 2 to 3 hours, and the duration of effect is about 5 to 8 hours. So this regular insulin is the only insulin that comes in intravenous dosage form, IV dosage form. Therefore, often this regular insulin also used for medical emergencies like in ketoacidosis cases. Intermediate acting insulins are basically it is a neutral protamine hydron, NPH in short. Insulin is a basically regular insulin mixed with protamine and zinc, and which delays the absorption. Its delay absorption helps in its extending the duration of effect. So the onset effect is about 1 to 2 hours, and the peak hour effect can be 4 hours, and the duration can be about 16 to 24 hours. Generally, it is given twice a day or once daily at bedtime. Long acting insulins or insulin glargine. Insulin glargine is prepared into the pH dependent precipitation and at the injection site before being released into the bloodstream. So it does have those precipitation and gradually release, and that extend the duration of effect. Detamere is attached with the fatty acid chains which bind to the albumin before dissociating and becoming active, and that extend the duration of effect about 18 hours to 24 hours. So long-acting insulins here, onset is about 1 to 2 hours. However, they do not have a peak effect because they do have a steady action of the drug. So having a no peak effect, in many ways, it is advantageous, such as it have a less likely can cause hypoglycemic side effects. That's the advantage of this long-acting insulin, which has no effect and steady effect of the drug. And the duration of effect of this insulin glargine and detamere is about 18 to 24 hours. So sometimes detamere, which is a brand is levemir, sometimes is given BID as well. Next, you have an ultra long acting insulin. Ultra long acting insulin is a degludec tresiba, which is forms the multihexamer beneath the skin after injection, which slowly absorb from the subcutaneous tissue. As a result of that, it extends the duration of effect of this insulin. And this also has a steady action. There is no peak, so therefore there's a less likely chance of having hypoglycemias. Onset can be 30 to 90 minutes, whereas no peak, and the duration of effect is up to 48 hours. So, therefore, this insulin has a slightly flexibility in order to have daily insulin, and because of the longer duration of effect. So, next, other types of insulin regimens are combination of two insulins, such as most popular one is the rapid acting insulin and long acting insulin. Generally given three rapid or short acting insulin before meals in a daytime, and then one long acting insulin or intermediate acting insulin is given. So that produces like three short acting insulins or rapid acting insulins are given with breakfast, lunch, and dinner, and then one single dose of long acting insulin can be given at dinner or in the morning. So those are the a common insulin regimen with combinations. Here, let's look at the insulin mechanism of action. How does that insulin helps? So, insulin mechanism of action, insulin bind to the insulin receptors, which is present on the cell membrane. Insulin receptors are tyrosine kinase receptor family receptors. Once insulin bind to those tyrosine kinase receptors, which is present on the extra like cell on the cell membrane, and those insulins, once it bound to those tyrosine kinase, then signaling pathways stimulates and triggers, and those signaling pathways are activate those insulin sensitive glucose transporters, and that helps to glucose channels to be open up, and thus glucose intake takes place inside the cell. So therefore, insulin, the primary effect of the insulin is regulation of the glucose or glucose metabolism or managing those glucose levels in the blood. So let's see how does this insulin helps to do those regulation of the glucose. So the primary effect of the insulin is on the glucose uptake into the um, tissues, peripheral tissues. When glucose uptakes in the peripheral tissues, when glucose uptakes takes place into the tissue cells, as a result of that, there's a decrease in the blood glucose levels. So that means that prevent hyperglycemia or increase glucose levels in the blood circulation. So therefore, the peripheral tissue glucose uptake is primary function of the insulin. That way it controls the glucose levels in the blood. And another important function of the insulin is in the liver. In the liver, insulin converts glucose to glycogen, which is a glycogen is a storage form of the glucose, and therefore excessive glucose that produced in our diet or meals, that glucose will be uh, s- stored into the glycogen form in the liver and also tissues. So that is facilitated by insulin, and that also helps again to control or regulate the glucose levels in the blood circulation. The other function of the insulin is lipolysis. So basically, it does stimulate the lipogenesis, like formation of triglycerides and fatty acids. And also, this helps in protein synthesis as well. And another important function of the insulin is insulin activates sodium potassium ATPase pump. So that means is that helps potassium enter into the cell from extracellular potassium into the transport to the intracellular spaces. So as a result of that, potassium shift from into the intracellular spaces, and therefore the blood levels of potassium decreases by activation of the insulin. So that decrease in the blood potassium level can be referred as hypokalemia. However, this is a function of the um, insulin action mechanism of action of the insulins. All right, so let's see the clinical use of the insulins. The clinical use of insulins are mainly used for type 1 diabetes and also type 2 diabetes. And also regular insulin, which comes in IV intravenous dosage form, generally used in diabetic ketoacidosis. And let's say the insulin is primarily comes in subcutaneous dosage forms, and only one is comes into the intravenous. So therefore, the subcutaneous dosage forms of insulins are administration sites. So most commonly used administration site is the abdominal area. The abdominal administration of insulin injection should be at least 2 inches, which is equal to 5.1 centimeters from the belly button or navel. So that should be when you use for abdomen. And alternatively, you can also administer through thigh, upper arm, and also buttocks areas as well. However, never or do not inject within 2 inches or 5 centimeters of your navel, and then the middle of your abdomen, and into or near scar tissues or stretch marks, and near joints and groin area. Insulin should not be injected. Then, one common side effect of insulin, if regularly injecting on the same site, and that can result into condition known as lipodystrophy. What is that lipodystrophy is? Lipodystrophy includes two things. One is a lipohypertrophy, which means thickening of adipose tissues, and lipoatrophy. Lipoatrophy is thinning of adipose tissues. And both of them can affect on the insulin absorption. So therefore, it is recommended that rotate the injection site to reduce the lipodystrophy, and also it can result to localized cutaneous amyloidosis. So these are the site injection site or insulin injection side effects. So the other important thing about insulin is a protein. Since the insulin is a protein, it is often sensitive to temperatures and also the external environments. So therefore, insulin storage conditions, all insulins are stored in the fridge in the pharmacy, and however, types of insulins have a difference in their storage conditions. Insulin vials and also most of the insulins, such as until the insulin Lispro aspart is 28 days, and then glargine can stay up to 28 days, same thing. However, detamir have a longer 42 days, 6 weeks, and insulin degludec, Tresiba, which is a 56 days longest duration of effect. And also Tresiba can be open pen can be refrigerated as well. Whereas all other pens, insulin pen have once it is open, that has to stay outside of room temperature at room temperature. So let's look into the side effects of insulin. So primarily main side effect of insulin is hypoglycemia, and this hypoglycemia often associated with the high dosages. Normal dosages should not have hypoglycemia, or hypoglycemia can occur with combination of other drug that is known to cause hypoglycemia as well. Otherwise, if insulin alone generally commonly associated with the high dosages. And also, other side effects include common side effects include nausea, headache, etc. And then other one is a weight gain. So weight gain has been occurred, which could be attributed to anabolic effect of insulin, and which is also cause decrease in glucosuria. That can result into weight gain as well. So who should not take insulin? Like is contraindication. Contraindication means during episodes of hypoglycemia should not take insulin. If someone is currently experiencing hypoglycemia, that's not a time to take a insulin. And also in systemic allergies, if someone had experienced an anaphylactic type of allergic reaction with insulin, they should avoid taking insulin. Next, warning and precautions. So insulin is one of the known to cause this medication error drug. So therefore, ISMP has designated this drug as a high alert drug. That means this drug error can result into potential harm to the patients. So therefore, that require extra precautions. And ISMP has made recommendation what kind of precaution have to be taken when you're dispensing uh, high alert drugs. So, and generally have found that errors in the insulin administration or insulin dosing results into hypoglycemia. Well, insulin also has lots of drug interactions, and let's look at this some drug and drug interaction. So, in drugs, some drugs combinations they cause hypoglycemia if they are taken with insulin. Like, for example, anti-diabetic agents, sulfonylurea, especially glyburide with insulin can significantly increase hypoglycemic side effect. And sulfanolamide antibiotics as well can cause hypoglycemia with them. And other drugs such as ACE inhibitors, ARBs, and fibrate, fluoxetine, and also many other drugs can. So when there is a combination of these two drugs concomitantly used, what kind of action have to be done? How do we minimize this drug interaction problem? So this can be done by dose adjustment or adjusting the insulin dose or increase the frequency of glucose monitoring when insulin is used together with this drug. Those are the measures have to be taken to minimize those uh, in drug and drug interactions with the insulin. Also, there are some drugs can blunt the sign of the hypoglycemia. I mean, they mask the sign of hypoglycemic symptom. So that means patient may not feel hypoglycemia even though they have a severely low blood glucose. Like for example, beta blockers are best examples. So when someone take insulin with beta blockers concomitantly, they may not experience symptoms of hypoglycemia. However, they will have a low blood glucose, and that can be potentially dangerous to have low blood glucose. Same intervention, increased frequency of glucose monitoring when you're using this together. And other drugs, they lower the or increase or decrease both. They can change either both way. So, this is, for example, in this case, they decrease the effect of the insulin. For example, olanzapine, clozapine, antipsychotic drug, well known for they do reduce the effect of the insulin. That means they may not produce the same effect as a normal person get benefit of the insulin. So therefore, when someone is using these medication, they have to frequently check the blood glucose and make sure they adjust the dose of the insulin. Another case which is commonly seen is the drugs that increase or decrease both. Either can happen, depends. And especially acute and chronic alcohol intake can result into either decrease or increase in effect of blood glucose. So again, the same intervention. One is minimize alcohol intake, and then also acute alcohol intake can result into severely hypoglycemia. So therefore, persons who are taking alcohol should be frequently monitor blood glucose to minimize the risk of severe hypoglycemia. Next comes to the pregnancy. Pregnancy, insulin pregnant women have not identified any drug associated risk or major birth defect or miscarriages. So adverse maternal or fatal outcomes. So they have not been found in the literature. So therefore, for each specific insulin product, you have to use that reference to see the check the safety of the insulin in the pregnancy. So follow the each insulin drug monograph that helps you to identify those. Next, breastfeeding. So there is no published reports of adverse reaction in the breastfeed infants, or therefore that's it is used in breastfeeding. Pediatric use, the safety and effectiveness of insulin to improve glycemic control in diabetic have been established and it is used in pediatric patients. Again, use specific insulin product monograph for each different insulins. Next comes to the renal impairment. So renal impairment increase the risk of hypoglycemia. So therefore, it does require dose adjustment in renal impairment patient. Same way, in other chronic conditions such as hepatic impairment, the patient have likely also have an increased risk of hypoglycemia that require frequent monitoring and insulin dose adjustment. All right, so with this information, thank you. And these references taken from the FDA drug monographs of insulins and daily meds. Stay tuned for more drug monograph and subscribe Pharmacy Prep channel. And thank you.